You can't keep anyone in the United States from voting without hurting the rights of all other citizens. Democracy is built on this. This is why every man has the right to vote, regardless. Is what I'm saying true? Yeah. Is it what you think and what you believe? Yeah. Move back. If we're wrong, why don't you arrest us? We're willing to be beaten for democracy. You beat people bloody in order that they will not have the privilege to vote.
Thank you, Elder Maxwell. When we started this conversation, I started by talking about the Christian triple consciousness, how we have to navigate being Black and Christian and American. And every now and then, when I see that old footage from the 60s and 50s and 40s, and they sicking dogs on us and putting hoses on us, every now and then, that Christian goes down a little bit. Just if I'm being honest, just a little bit. Before I let you go, Elder Maxwell, though, I want you, if you could, very briefly talk about the importance of the down ballot, because I know a lot of us are focused in on the presidential elections, and I'm not saying that they don't matter; they are very important. But the local elections are vastly more important to the average person, are they not?
Absolutely. I think what happens is we, because the presidential elections get so much gas, they get so much gas, they get so much footage, and so there's so much conversation happening about them. And again, that to me is back into when we talk about systemic systems that are suppressive to African-American voices. I think the downplaying of the local elections, if you will, I mean, they don't get nearly as much screen time as you would say the quote unquote larger elections. But when you think about it, when you in the local elections, you are electing your sheriffs, you are electing your commissioners, you are electing those people that have immediate impact in your communities. They're your superintendents. All of those things are happening in these municipal elections. And again, those same websites that I gave will give you detailed information on each one of those things. Again, it can be overwhelming when you look at it. But let me say this, just in the community that I'm in, when the local elections are happening, white folks are showing up in those local elections. And conversely, they have representation. When it comes to those things, they're fighting for funding for their schools. They're fighting for, the commissioners and things that they want. They're fighting for those things. We've got to show up in each and every one of those elections. And it's easy to find it may seem intimidating, but those websites that I gave you will give you the election cycles and calendars for everything that's showing up in your area. We've got to activate on a local election. Those are just as important, more so than even the presidential elections. They have immediate impact in your community.
Right. Can you put that back up again, if you don't mind?
Sure, no problem.
Yeah.
No problem.
Pastor T.
Yeah, no problem, Elder Feature. Yeah, I mean, the presidential election, like it has an impact, but it's going to be a while before you feel it, because DC. I grew up right outside of DC, PG County, Maryland. It's red tape. It's meant to move slowly. It takes a lot to turn a big ship. But those local elections, you feel that from the moment those people are installed in office, you begin to feel it's judges and judges that influence prison sentences and all of these things that matter like so and has such an immediate impact.
And they're all working together as one system locally, on a local level. The judges, the commissions, all of those things are working together as one system. So then it makes it easy when they're all aligned, because they don't value Black lives. You say you have a judge that doesn't value Black lives, a commissioner that doesn't value Black lives. So then you wonder how a Black man can be killed and they never bring any charges against this person, or it doesn't even, or evidence is suppressed or things like that. It's because the system is working as it should. So if we don't attempt to impact the system on the local level, you can vote Barack. This stuff was happening when we had a Black president in office. To show you that the impact, it's great. It's great to have a Black president. That's wonderful. But you got to begin to impact your municipal representation as well if you want to see change on all levels. And we have to stress the importance of all of those things.
I'll leave this conversation with this. We are all still appalled at the miscarriage of justice that is the Breonna Taylor case.
Mm-hmm.
But the Attorney General of Kentucky, Daniel J. Cameron, is an elected official. He's an elected official. And so, if we would have elected a different person, maybe, just maybe, there would have been a different result. Elder Maxwell, thank you so much, sir.
Thank you all for having me. I certainly appreciate it.
Thank you so much. Wealth of information. Elder Maxwell, thank you again. We'll be in touch. We're going to do this again, especially this information on voting. As you can see, I do have on a shirt that simply says vote. And it was designed by a friend of mine. And so I'm helping her promote today. And they are available. And we do have the information for you, but they're beautiful. She's an artist. She's a local artist here in New Jersey. And thank you. And shirts are available. So there you are. This is her artwork that she utilized. Thank you.
All right.
Just a little plug.
Get my, if anybody wants to order one for me, I wear a extra large or a 2X if I'm feeling myself. But it was the year I got married, 2010. It was the year I got married, 2010. My wife and I got married April 17th, 2010. Still.
Beautiful day.
Still. That's your birthday?
Yes. April 17th.
See, I knew I liked you, Elder Feature.
See.
So April 17th, 2010, we get married. July 9th, 2010 is her birthday. We're out celebrating. We go to breakfast and all these things. And I am using the restroom, and I'm not lying. About every 10 to 15 minutes, I gotta get up and go use the restroom. And it was like bad, but I was still thirsty. But to quench my thirst, I was drinking Coca-Cola, and then just had to run to the bathroom. And so we go to her best friend's house, and her best friend says, he's going to the bathroom a lot. Something might not be right. So her grandmother has diabetes. And like, I know that thirst and frequent urination is a thing. Like, let's check your sugar. They pricked my finger, my blood sugar, the machine read back ER. It didn't read back a number. It read back the letters ER, which I thought meant error.
Right.
When we looked it up, it means go to the emergency room because your blood sugar is too high to be registered by this machine. So we drop everything. We go to urgent care. Why? Because I didn't have insurance at the time. And so we go to urgent care. We have to pay up front $500 up front. in order to get treated at urgent care.
Wow.
They took us to the back. They used their machine. Their machine says ER. Let me tell you how bad it was. They refunded our money. They said, take your $500 back, go to the hospital like now. Don't make another stop. Don't, tell your husband don't go to sleep, and go to the emergency room right now. Apparently, they had to draw my blood in order for me to get an accurate reading. Apparently, my blood glucose was somewhere in the 800s. And for those of you who don't know, normal blood glucose reading is between 80 and 120. And I was at over 800. They said to me, first and foremost, we're surprised you're still alive right now. We're surprised you're not in a coma right now. And who knows how many days later it would have been, but it could have been another story. It could have been another way. But it's interesting to me, though, that how many people, so my wife is a financial guru. Y'all should go follow her. Her name is Yolanda. She has a YouTube channel with like 60,000 people. She teaches the full gospel all the time. Her name is The Organized Money. Because of her, we were able to pay. Because of her, we were able to pay. But how many Black folks have no insurance, they're uninsured, they go to urgent care, or they try to get health care through the emergency room, and they can't pay? And they have to go into debt, and they get swallowed up by this system that, again, was designed not to serve them. And so not only is the Black vote important, but we must begin to, through our vote, through all of the avenues available to us, we must begin to address the health disparities that are going on in our communities. We are unfairly represented in all of the worst categories, in obesity, in diabetes, in high blood pressure, in curable and avoidable things. And so we have Bishop Simon Gordon. Let me do another shameless plug. His new single, I'm Gonna Run, is available all over every streaming platform. I got mine up right here, Bishop. I'm gonna run. I'm gonna run. So he just released a single. He serves as the senior pastor of Tridestone Church of Chicago, a full gospel Baptist church since 1989. He shepherds a congregation of 3,000. It has 30 support ministries and 14 senior pastors who are responsible for their own congregation. Bishop Gordon served as an advisor on the White House Faith-Based Council during the first term of President Obama, the only president we acknowledge around here. And he's partnered with St. Jude's Cancer Research Children's Hospital as the associate of the Sunday of Hope Promotions out of Memphis, Tennessee. And of course, corporately, Bishop is involved in the Tehillah Music Group, where he serves as a board member. I don't want to do too much more, but Bishop Simon Gordon is coming, and there's an entire panel of specialists who he'll be interacting with as we move forward. So Bishop Gordon, we're in your hands. Health disparities in the Black community.
Thank you so much. You guys hear me? Pretty good?
Yes, we can, sir. Thank you.
All right. Thank you, Pastor Fingo, and of course to the wonderful Elder Julia Feature. Thank you for sharing, giving us this opportunity to kind of share on this particular day. Everything so far has just been wonderful, and so look forward to being able to share this as well with you. This whole Voice of the Black Church Forum with many thousands down the line. Well, let's kind of get to where we are with looking at the health disparities. And you are right, Pastor Tori Fingo, about one of our major challenges that happen in our community is that sometimes we are sick and do not know it. And part of that reason is very much attached to our historical avoidance, as well as a systemic denial and pushing prevention for us. I'll give a simple concept. She gave some information. You gave a little information regarding the terms when President Obama came in. Right before President Obama came in Illinois, we were running 6 different programs for health services for the state of Illinois. And of course, childhood obesity, diabetes, HIV, prostate cancer, breast cancer, on and on and on, those things. And they were allowing us to do prevention programs and making sure that the underserved communities had opportunities to really know clearly what and how to pay attention to our bodies, ourselves, our families, and also to do two major things we always need to do: have annual doctor visits and make sure we get blood work done to know kind of where we are with the whole process. I can say, based upon CDC statistics, that between 1999 and 2015, leading causes for death in African Americans have decreased based upon what HIV did was make us pay attention to our bodies and our lives a little bit better. But in the same instance, I mean, we've gone down in heart disease, we're pretty level in cancer, and we've gone down a bit in strokes. But that's been based upon things that happen, like you just mentioned, Pastor Tori, and kind of deals with the fact that we are discovering around us people who are aware of things that we need to be paying attention to. Nevertheless, some of our biggest challenges is we are stuck with a systemic denial. And that systemic denial really ignores the history of what it takes for us to, be healed and to survive. Say, for instance, you take something as simple as medicine for hypertension. It is different based upon, our DNA. African Americans are different than Hispanics. And also that medicine is different then as well for Caucasians. That's why clinical trials, something we have to eventually get ourselves into a little bit more so that we can have medicines that meet us, that deal specifically with our needs, that actually match our DNA, that we can get our healing from much easier. And so all of ours has been kind of ignored, but we have to tell the truth. Historically, remedies from Africa have been adopted in this particular country. And have been used. I mean, herbal ministries and remedies. The influence of slaves on the antebellum medical community is an interesting web source. The influence of slaves on the antebellum medical community. And it speaks specifically about all the herbs and things that came from West Africa that was brought over in the ships, in the grasses and different things that end up being used. Some about that community, as well as the community that, of course, African Americans were taken to in this country, kind of matched. And so those medicines were often used by us and eventually adopted by, of course, our slave masters and different things along the line. And of course, what they did was they made business out of them. We gave it up free and they made business out of them. And at that particular point, of course, they've made millions, as of we see all the different things in this country. They've gone along that particular line. But our challenges, even in all of this, with systemic denial of who we are, we need, what helps us function, has been a challenge in the process of redlining. Now, I'm here in Chicago. Being here in Chicago, we're in the midst of wrestling with the fact that in some of the urban cities, we really need trauma centers attached to it. Now, in Chicago area, there used to be trauma centers in the South Side and the West Side. So if someone had a dire emergency, they can get to a place where they can get service right away. For the last 10 years in Chicago, there's no trauma centers really in the areas where African Americans live. So that means that if there is a gunshot, if there is someone that's having a severe stroke, or someone suffering with heart disease, or someone who has had a major heart attack, they have to go all the way to the other community to get service. In most instances, they die. And because of that, we're in the middle of arguing with our government process, our governor's process right now, and about making sure that our community as well gets dollars, that we might have our own centers. Now we have a conglomerate group of doctors and lawyers and business people, as well as faith people and community people who have come together specifically in the area to ask for over $1 billion to make sure we cover our particular community because of the level of the issues. We also push, and I think that needs to happen, is that in all of our churches and all of our ministries, and see, we're talking about Voice of Black Church, we have to push the issue that our churches have to take an active role in the health of the people. This whole deal about, what it used to be, we just cook on Sunday, and while the preacher's preaching, the fried chicken is cooking, and by the time we get through preaching and singing and shouting, go downstairs, and certain people who are hungry, I don't know what's like in the South, but I got certain people that when we used to do, I cut all that out. Before I could get through preaching, they already down there getting their seat in the dining room, ready to eat.
Bishop Love did the same thing when he got to then Greater Antioch, now the City of Love. He was like, they was cooking bacon and sausage and that. He said, you can't, I don't care how good you preach, you can't out-preach the smell of bacon.
I cut it all out. I said, no, we're not doing any of this anymore. And that's the only thing. And what we started was awareness and prevention. Let me tell you one of the blessings that came out of that, because we ended up with a couple people who needed kidneys, and out of our two men in our churches ended up needing kidneys, and because we were so so advanced in moving forth toward making sure we participate, we start asking for donors to be a part. We had two ministers that literally were able to give kidneys to two other men in the church, save their families, and continue. That's because of making sure we have the voice that people get a chance to really hear. We have to be a part of helping each other, and we have to participate in devising and using health ministries. And so the prevention and the awareness part of it has to be something that the church as well as the community pushes. Now, of course, as always, Julia and I always had this conversation, are there dollars out there for this? Yes, there's always dollars out there for this kind of thing. And it's all about making sure somebody's going to talk about that pretty soon. I think Bishop Rudy is going to talk about that. There are dollars out there for different programs that you run, but there are several things that have to happen before you have to have the infrastructure. You have to have the ability to do that, and you have to be able to touch the powers that be in community to make those things begin to happen. I had one particular case, and I know my segment time is almost over. That was similar to you, Pastor Finkel. It's not a positive case. It didn't end up positive, but I had a professional basketball player, and I don't mind I mention his name, and I know he wouldn't either at this particular. He wouldn't, because he told me, he said, Bishop, use my story as a way to help some people. His name was Anthony Mason. He played for the New York Knicks. He was a member for 13 years at my church in Chicago, and I would go to New York with him. We'll go up to the Knicks camp and lift weights and do different things. And we went and saw a doctor. He was having some heart problems, some chest problems, and my energy's just low. And I'm like, okay, Anthony, go see what the doctor, you're right here. The doctor tells him, does an x-ray, and then says, oh man, we need to check your heart and see what's going on. So he does the EKG, and he says, you may have some blockage. You need to get that checked out. I came back to Chicago, and basically I come back to Chicago. I called, I said, Aunt, did you go So, did you go and get that checked out and stuff? He said, oh, my energy's still low, but he said, but I'm gonna go in a little while. 2 weeks later, after that he had gone, he had a massive heart attack in New York. And so I ended up going back to New York. They have him on the machines, gathering his family together, doing all of those particular things, but it was beyond. Now, because he was part of the Knicks, he got services that none of us would get. So he did get immediate trauma care. They did everything. They hooked him up with all kinds of things because they wanted to make sure they stayed alive. They kept him alive by using machines for over a week, maybe 2 weeks. He miraculously had a wonderful opportunity because they kept him alive, kept his heart going. They kept pumping at the same time fluids off of him, but it was too late. His cognitive abilities were still there, sharp, and he would say, "Bring my kids around." And so brought his kids around. He asked me, he said, "Please tell other people, don't wait." And that's really what I want to say to people. You got to know your body, and learn your body, know your body, and don't wait. We have 9 things that we are worse at and when it comes to having the result of it: heart disease, stroke, cancer, asthma, influenza, of course, pneumonia, diabetes, HIV. Those things are major that, we're beating everybody in dying from those particular causes. Know your body. When something different is going on, get to the doctor. Learn what needs to happen. Find out your family history. Go back and ask what took place in the history of my family. I made my children do something that my parents didn't necessarily make me do. I went and found their doctor, and they had their medical records. And I told my kids, this doctor's office here has had our family for the last 40 years. Let's see, when you go, let's see if you have any challenges, if it matches something that's happened down the family line. And now we've been able to find different things and get resolves much quicker for the girls as well as the boys, because we paid attention to what the family line and medical situations really were. And so it's important for us to kind of take and do that diet and exercise. And then for resources, if you want to really find out numbers about where we are as African Americans and disparities, Human Health Services, HHS.gov, gives us a lot of information about where we are, as well as CDC.gov. All you have to do is put in African American or AA disparity, and all the statistics are right there, attached to living in poverty, attached to unemployment, all the risk that's attached to mental illness. And that's why we have this whole core of people who are behind us, that's behind me, that's getting ready to talk next on these particular issues. I would like to, I'm gonna jump in when Dr. Corey talks about COVID, because here in Illinois, I got a chance to lead the COVID process with the governor. Now, these items from COVID to mental health and suicide, diabetes, the whole process of what we should be doing. Yolanda Mack's going to talk about healthy lifestyles are all important for us to get where we need to be when it comes to for us to close the gap between what we have, what we experience, and what we know. That's all I'm going to say to that. I'll add to it as we have some dialogue along the line, Pastor Fingo. But I think we're about to at time for Dr. Corey to kind of spend some time and tell us about what happened here in COVID, and let's talk about that experience, and maybe we can join together and have some dialogue on that.
Perfect. Thank you. It is a blessing to be here to talk to you guys. I'm meeting so many great people through Elder Feature. Want to respect and thank her pastor and her bishop, Carlton, who's on the line. COVID has been, let's take a history lesson very quickly. In 1827, one of the planters actually said that Blacks survived much better in Southern climates, and they were meant to be slaves. So it was just like God kind of set them up to be in this worse situation because their bodies were built for it. In 1863, when slavery ended on January 1st, 1863, through the period of the Civil War, about 1862 to Juneteenth, when slavery ended, much of the Civil War deaths for African Americans came from the planters said blacks didn't need medicine. So many times when we got sick, they wouldn't even give us the medicine we needed, from dysentery to diseases in the water, to malaria and other forms of illness, typhoid fever, black lung disease, which was tied to tuberculosis, killed many in the black community. All of those issues tie back to trust. And if we don't, and being scientists, we know you need to have more than one study on whatever it is you're about to put in my body. We have lost trust in the system. As Bishop Gordon spoke about, we are in a position where we keep running back to, hey, syphilis. That is a serious thing. The Tuskegee Institute experiment on black men. That is a serious issue. And there were many other issues. They actually practiced cesarean sections on black women without pain medication in the 1800s, just to see what do we need to do and how much pain could they handle. So the idea that COVID now, we're talking about a vaccine, one of the key things I want to share with people is be informed. And I think Bishop Gordon said this, and Pastor Finkel said this, and others. We need to be informed. We need to make sure that we're not just taking whatever people tell us to take. When he spoke about blood pressure, the drugs that usually work well for African Americans are called ARBs, the angiotensin receptor blockers. Because in ARBs, you find that the water associated that is actually attached to our body, because we come from a climate where we needed more water in our system, we hold more water, which leads to us actually having more water in our system, causing our blood pressure to be higher, because you have more tension on the areas of where the blood is pumping. So we actually add in a hydrochlorothiazide, and it strips the water off your body. So now you relieve that, you remove the water, and you block some of the angiotensin receptors. Those areas of reducing blood pressure, when you study and learn these things, you're more apt to feel trusting because you have some information. But not sitting in the doctor's office asking questions, it's not strange that a person wouldn't be able to. So take somebody with you that knows. If you're not familiar what questions to ask, most of the time they give you a diagnosis, you're in shock. So have somebody there to speak on your behalf, and take the crazy cousin, take the crazy uncle that got a little bit of information. Because the doctor, look, I got other patients to see. No, you don't. I need you to answer this question. What was that word you just used about my mother's health? There was a story I'll tell you very quickly. We were actually looking at it's a drug for chronic idiopathic constipation, and it's called Amatiza. So my grandma was like, oh, baby, the bowels are so important in the older community. I need to clean my bowels out, baby. Can you give me one of those Amatizas? And I say, Grandma, you don't know what it's for. So we go see her gastroenterologist, and he tells her about it. I'm reading the back of it, diarrhea, all types of problems, because chronic, idiopathic, they don't know why you're constipated. She takes it and literally misses Bible study, church, because she was on the toilet for 3 days. Church, she missed the prayer call. I mean, literally, it cleaned her out. And I went back and read even further, and that caused me to read the package insert, the PI. What are the side effects that we're taking that we're getting when we take these drugs? So back to COVID. COVID has been shown to not only cause issues in the Black community, because we have these diseases that cause inflammation in our system. And inflammation, one of the key things is racism, subjugation, causes inflammation, causes stress. Black women have been shown, even with a high school, a college education, a law degree or doctoral degree, have worse health outcomes for their children compared to white women with no high school diploma. Because the one thing they figured out is we can't control for the stress we carry from racism and discrimination. So with COVID-19, I caution everyone to be informed, one. Two, take the precautions that you already are aware of. Black people have always worn masks, so it's not uncomfortable for us to put a mask on physically, because we've had to wear a mask, as Tori and I joked about earlier and talked about, we've worn masks just to fit into society. And then also we need to be cautious about how close we are to one another, especially our youth who are running around and feeling invincible, because you don't want that on your conscience, that the inflammation now has caused the issues with someone being able to breathe. I'll leave on this note. Globally, in Africa, they're actually having a much better health outcome for COVID-19 than anywhere else in the world. And you would say, why? I mean, this is a third world country. Well, what they've discovered is much of the things and practices that they learned through Ebola, washing their hands, isolation, allowing for each other to quarantine, giving respect to the home of someone that's sick. Through this, we need not forget, and going back to my message earlier, we need to remember. We need to remember the things we did before. You see somebody don't wash their hands, it's nasty anyway. Call them out on it. Come on, man. Look, we wash our hands. I know you're not about to go in the kitchen. But until we get to that place that we are in a position of power to speak power and speak truth to power, we're going to allow people to make us sick. And most of us get sicker from going out to eat than we do from just being home and not taking good precautions. So I'll leave it there, Dr. Gordon.
Well, can you say something specifically on the necessity of getting the COVID test? For some of our communities, we wrestle with the test, the whole idea of the test, just like we wrestle with flu shots.
Yep.
You know, up here in North here.
So a lot of churches, I know my pastor asked me, because I do a lot for just helping him with the technology and organizing. He asked me, hey, can we think about how to get more people to come back? Maybe we take shifts. And my concern is with the numbers rising around the world, in many places, you're not getting test results back quick enough. The problem is not the test as much as it is, one, we do need to be tested. But two, after you get tested, until you get the result back, you need to be cautious about what you're doing. Because getting a test and somebody telling you that you're negative, and you were just running around at Leroy's birthday party, and you were in Susie's backyard 2 days after the test, we don't know what you have now. So the key is to be tested, but at the same time, be smart about what am I doing between the test and my results. Because if you're going to get the test and you're not going to practice social distancing, wearing a mask, and being cautious about who comes in your house or who doesn't, then we're now in a position where that test is invalidated. And checking someone's temperature is great, but that's only going to tell you whether or not they're actively ill. And now that we know that a lot of people that are pre-symptom or no symptom ill, we're catching people that are actually spreading and sharing disease. One day, while we're not on this call, look at your phone when you get off the phone talking to people, and see how many splatters you have of your spit from just talking land on your phone. And then think about how much is shared and you talking to people in a closed environment.
Great. And what do you think about North taking flu shots? Because that's another area. You know, we're still afraid to deal with some of the preventive type of things. What do you think about taking flu shots during this particular season? Specifically because some of the initial symptoms of COVID and the flu look alike.
Yeah. So there are 2 different types of vaccines. Well, actually 4 different types of vaccines, but without going into the science of it, one of the things we need to be aware is that our body is trying to build up an immunity. You'd rather not be sick to build up that immunity. You rather get it through what they make is like a fake way that the body builds up those T cells that actually fight off the macrophages and the other things that appear in the body that says that it's sick or ill. So you're really trying to mask illness so that your body says, let me fight, and build up its immunity to fight off the disease. With the flu shots, it is better to be in a position where you can fight off the flu and have a stronger immune system than not be in a position to fight off the flu and potentially having COVID-19. The double whammy is actually going to be worse than having one over the other. So the flu shot definitely is what we would consider, it's a prophylactic. It's going to build you up and prepare you for any inevitable situation of potentially getting COVID-19 and having the flu too. So I can't make a recommendation because I'm not anyone's doctor, and my doctor is in public health, but I would recommend that you become informed, that you ask the questions, and a lot of pharmacies are giving them for free. A lot of public health locations are giving them for free. We are in a pandemic, which means that not only is it an epidemic and endemic, meaning that it's spreading in the community, but it's a worldwide situation. And we will not reach a level of herd immunity, which means where the term comes from, the herd. There were certain cows in the herd that had built up immunity, 70 to 80%, and the other 20% were protected, because when you sprinkle those 20% around, you're actually less apt to come in statistically to come in contact with someone else that is ill. So you imagine right now in the country, we're about 5 to 7%, a little less than that. So for every 100 million, you need 7 million people to be sick at 7%. We are about 7 million right now. So in order to get to 70%, we're probably going to be about 100 million. No. So that's 307. So we're going to be looking at about maybe 490. So for every 100 million, yeah, we need about 70 million people sick. So that's going to be 210 million people need to be actually sick or having recovered from COVID-19 mathematically. So 3 times 70. And in order to get there, that's a lot of people. We only had about 7 to 8 million people that have been sick. So don't wait on herd immunity. Go get your information, go get your flu shot, and look for your resources to learn as much as you can. And don't be the first lined up to get any vaccine without having the knowledge of what was done to study that vaccine.
Good. Awesome. Great information. Thank you for sharing. And I would like to co-sign on what you said as far as Africa. I go back and forth to Africa a lot. And in February, I went to Ghana. And the first thing that happened when I got off the plane, they checked my temperature. They had on a suit, almost looked like a hazmat suit. They wanted to make sure that those of us coming from America weren't bringing anything in. And we didn't even speak about COVID large until we got to March, but that was in February. And so, so they were very much aware ahead of time. Well, that leads us to, I think this is just a perfect segue for us to go into family matters and look at faithful families and healthy lifestyles with with MBA Yolanda Mack. What can we do to make sure that we get our lives in order and make sure that we are properly aligning ourselves so that we can really deal with this health disparity issue in our Black community? Yolanda Mack.
Good morning, everyone. Thank you for this opportunity. Elder Julia of God Vision. I'm going to just share some information with you that we're doing here locally. However, it can apply across the country and in the world in particularly. So Faithful Families, Thriving Communities is a evidence-based curriculum that we use here. It's funded by the Department of Health with the organization Greater Newark Healthcare Coalition. And the mission is to inspire faith communities to be health champions for individual families and local communities. The way it works is it promotes individuals as well as that are a part of a faith-based organization. It's been practice tested, and what it does is it allows you to use your faith to connect to your health. And particularly living in this pandemic that we're all living in, some of the key things that we can begin to all do is eat smart, eat smarter, move more, and try to deal with some of these pre-existing health conditions that we all or some suffer from. We have individuals ourselves, family members, co-workers, church member, family members. We just want to begin to do things that are good and that are going to help us do that. So we're always promoting direct peer education. And what we want to do is institute policy systems and environmental supports, have community engagement. And how this program works is we sign up faith-based organizations, no matter what their religious background is, and we give out handouts, we give out skill builders, and particularly, and I'm talking about quality things like portion control plates, jump ropes, mats for exercise. We give out air fryers. We give out a host of things that can help combat, because we don't want to just talk and tell people what to do. We want to give them the items. The other thing in particular that we do is we offer grant funding, where the particular faith organization will take that grant funding and institute some type of health and wellness within their faith-based organization and their community. And the whole idea is to begin to get people to combat some of these health issues, because people, believe it or not, are going to the emergency room to deal with things that they can do themselves if they manage their health better. So I'm gonna share my screen real quick with my information while I continue to talk. so that you have it. All right. So, like I was saying, it's practice tested, it's health promotion intervention, it's open to all faith-based traditions. The curriculum is out of North Carolina University, and it's called Faithful Families Thriving Communities. Promoting and connecting faith and health is important. What I like about it is that it actually connects your faith background. So no matter what religious background you're affiliated with, you use what helps you. So I'll just use a favorite scripture that I use all the time when I'm facilitating these sessions, which is Isaiah 53:5. He was wounded for our transgressions. He was bruised for our iniquities. The chastisement of our peace was upon him, and with his stripes, we are healed. So we're living in this COVID environment, and a lot of times people are trying to figure out what to do, where to go. One of the other services that we provide is we have people that participate in the sessions. We'll actually reach out to them after they're done with the sessions that we're now doing virtually, because we want to practice social distancing, so we're not meeting in person. So we are logging on and doing these sessions virtually. And we give the information to the persons, and then they love it. They get gifts, they get gift cards, they're able to prepare recipes, they get cookbooks, all types of things that can assist them overall. So once the faith-based organization is complete, we'll meet again. We'll have their information to reach out to them. So a wellness coordinator will contact them individually so that they don't have to share their personal information over the internet. And then they'll ask them, how are you doing? Are you in need of anything? Because we're connected to several organizations across the county and state, depending on where you're located. So once we do that, we'll connect them literally with, if someone is in need of medication, where to go, how to get it, if they're in need of a food pantry, several different things and items on a regular basis. We'll continue to do that. I want to put here it is. So here's my information on the screen so that if anyone is local, they can take that information. And we are now dealing with people in Newark, Irvington, the Oranges, but we also have this program located across the state of New Jersey. And remember, I said Faithful Families Thriving Communities is also national. So you don't have to be in New Jersey to participate. You can actually reach out to North Carolina University to get the information directly so that you can begin to get your faith-based organization involved. And like I said, direct peer education, policy and systems changes, and community engagement. And in closing, I'll just say that we want to continue to eat smarter, right? Move more, practice social distancing, wear your mask, and vote, 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 vote.
Thank you so much, Yolanda Mack. Great information. Thank you for sharing with us during this particular time. And then I do have to give a shout out to my bishop brother, Bishop Rudy Carlton. So good to see you, and so glad to see you supporting Elder Julia at this level. Thank you so much for being that man of God that you are. I want to share also one other quick thing with you before we move forward to the next area. And that is for those who really want to know how to engage faith-based communities with health research and to step into those areas, there is a book for that. And it's actually, that's the name of the book. It's a research ministry ambassador's facilitator manual. And it is called Engaging Faith-Based Communities with Health Research. This is actually the book. You can get to write that down real quick. And it's really sponsored by Total Resource Community Development Organization. I happen to have the opportunity right now to chair a group at Northwestern University, and we actually certify IRB certified researchers that are faith-based oriented to help deal with disparities in our community and get that information out across the board. And so, of course, our information will be available at the end of this, where you can actually access any of that. And this book is available, of course, on all the regular mediums that you can actually order it. As you see, it is pretty thick when you talk about health research and specifically dealing with our communities and Hispanic communities. And this was done particularly by my team. And so I just want to share that with you. Well, we move from Yolanda Mack, thank you so much, to Pastor Francis Teabout, which is going to deal with mental health and suicide. Here's another area that's so crucial for our community, mental health and suicide. Pastor Francis.
Well, good morning, everyone, and thank you, Elder Feature, for including me, and to Bishop Colton and to all of those distinguished guests on the panel. Thank you for having me. When we talk about disparities in this country, there is no area where African Americans are in the more privileged, desirable position. When we think about lack of equality, there is no area where there is a level playing field. The disparities in one area impact and contribute to disparities in other areas. There are disparities in healthcare, there are disparities in housing, employment, education. There is no area that is untouched. But the area I would like to focus on today for just a few minutes is mental health. According to the Health and Human Service Office of Minority Health, Black Americans are 20% more likely to experience serious mental health problems than the general population. There are a number of factors that contribute to this. First, as has already been spoken about today, there is the historical racism and discrimination that has dictated the experience of Blacks in this country since slavery. Then there's Jim Crow and civil rights. There is institutional racism that persists to this day. And then on the contemporary front, there are a number of issues that confront our country today that cause stress and anxiety to be elevated, but it is significantly more intense for African Americans than it is for the general population. For example, we represent only 15% of the population, but Black people account for 25% of the people who tested positive for COVID-19, and an alarming 39% of COVID-related deaths were in Black people. Then there is also heightened stress as a result of the police killings that we've seen on the news. There's George Floyd, Breonna Taylor, and the list goes on and on. But what's not included in that are the number of individuals who are assaulted, harassed, and murdered by police officers in our local communities day after day. These situations and individuals do not get national attention, but they compromise the mental health of the community. So again, there are a number of areas and things that contribute to stress and anxiety in the Black community. Then there is community violence. Which of us does not know a mother who had a son who was killed in a gang war, a drive-by, or some other senseless shooting? There's lack of housing, lack of employment opportunities. And then there's the high divorce rate, not only in the community, but also in the church. We see a number of single Black mothers raising children, trying to figure out how to make ends meet, robbing from Peter to pay Paul. They are living under high stress. And all of these things contribute to high levels of mental illness in the Black community. Of particular concern right now is the increase of incidences of death by suicide in the African American community. And this is a relatively new phenomenon because in the past, suicide was considered something that Black folks just did not do. But we are seeing those numbers on the rise. And not only are they rising with adults, they're also on the increase with our children. And so Black youth suicide completion rate is increasing faster than any other group. Black males between the ages of 5 and 12 are committing suicide at higher rates than any other racial or ethnic group. It is alarming, frightening, disturbing to think of a child 5, 7, 9, or 12 killing themselves, not only completing it, but even being so stressed, overwhelmed, or distraught by anything in life that they would think to end their life. According to the American Psychiatric Association, only 1 in 3 African Americans who need mental health actually receive it. And so it is important that we begin to do some things to turn that around. But first, let me talk briefly about some of the barriers to mental health for African Americans. One barrier is the stigma that is associated with mental illness. We still use derogatory terms like crazy, out of their mind, all of those kind of things. And there is a negative stigma associated with people who are stressed, and we see going to therapy as a sign of weakness rather than something to encourage. And so the stigma associated with mental illness is one of the barriers that prevents people from getting the help they need. Another barrier is the distrust of the mental health professionals. I heard some of the other presenters talking about the distrust and the Tuskegee experiment, the things that have happened to African Americans in the past that cause us to be distrusting of all healthcare professionals. But there is also a distrust of mental health professionals. Black people have had this idea that we're not going to let the white folks play with our mind and play with our head. And so there is a great deal of distrust. And then another barrier is the lack of providers from diverse racial and ethnic backgrounds who understand the issues of our culture and can help us to address them. One simple example I like to point out to help people understand this is, not long ago, I thought, my doctor told me I'm getting older, I need to do something physical to make sure that I keep the pressure down and keep the weight where it needs to be. And we decided that swimming would be an excellent exercise. And so I was sharing with one of my coworkers that I really wanted to start swimming, but I didn't want to deal with the hair. And of course, she had absolutely no clue what I was talking about and why that would be an issue of concern for me. But of course, every Black woman I said that to immediately understood the challenge of swimming every morning and then having to deal with the hair and get it presentable so that I could go to work and do what I needed to do. And it's a similar situation when we talk about mental health. When you talk to someone who understands your issues and can relate to it, and when you say that my mom is upset because I no longer eat her collard greens because of the things that she puts in it, you understand that. You understand, they understand that, mom is still cooking with the fat back. She's still pouring some oil in there when it's done. So it is beneficial to go to someone who has that background knowledge and they know what some of those issues and challenges are before you even present them. And so those are just some of the barriers that interfere and get in the way of African Americans getting mental health. And so the question is, what are some of the things that the church can do to help Black people deal with our mental health issues? The first thing that the church can do is be aware of the way that the church reinforces the stigma. The church has not traditionally encouraged individuals to go for counseling. We have encouraged them to pray, to seek God, to fast, to stay on their face. But the reality is there are some situations when you need a mental health profession to help you deal with. And so we need to look at the ways that we as pastors, ministers, officers of the church, even use scriptures to reinforce the negative stigma attached to having a mental health crisis. Another thing that the church can do is offer support. The church can be supportive of individuals, but there are a number of things that go on in our community that are traumatic to the individuals. The church can offer group sessions. They can offer a safe space where people can come and talk about what happened, how they're feeling, the consequences. The church can bring in national professionals, and thank God for Sister Julia and this vision to bring us together like this. But the church can do things like this and have individuals address what's going on, how you're feeling, and help people understand that some of the things that they're feeling are normal. If you are a Black woman and your heart starts pounding when your son walks out the door, that is normal. I can tell you that we're looking at this now, but over 20 years ago in Maplewood, New Jersey, my husband and my son were dragged out of the car by police officers. And so some of these things have been going on for a very long time, but they haven't gotten the national attention, and so we haven't addressed them. But in that silence, there have been Black men and women dealing with the stress and the trauma of those situations, even though it wasn't well known. And so the church can offer support. The church can also encourage people to get the help that they need. I heard the first presenter talking about, I think it was Dr. Torrey talking about his diabetes. And then Dr. Gordon talked about Anthony and having medical issues that needed attention. And they encourage them to go. And just as we encourage people to go and get their pressure taken and take the medications that the doctors prescribe, the church should also encourage people to go and have a mental checkup. If you're feeling stressed and you're feeling a way that you're not usually feeling, go to the doctor, go and talk to someone. We should also have a list of individuals that we can refer people to. So when they call and they say, I'm really having a rough time dealing with the death of my loved one, I'm really having a hard time moving past the violence that I've seen in our community, we can say, I understand, and here's a list of people that you might want to talk about, that you might want to go talk to help you through that situation. So there are a number of things that the church can do to help us deal with mental illness. And then of course, there is the thing that the church does so well. We can pray. But we can not only pray for those individuals, we can pray for those, our young people in the pipeline, pray for God to strengthen them, lead them, guide them, give them what they need to help us. I'm sitting here with my millennial who's helping me share my screen, who had to help me put my presentation together. And so we don't need to be upset that they know more about the technology than we do. We need to embrace them and ask them to help us. So we need to pray and seek God for those of us who are stressed and for those of us who can help those of us who need to deal with the stress. I am going to end on with a quote that I found on when I was reading Dr. Corey Henderson's bio. He had this quote that I thought was meaningful and helpful to us today. He said, healing is possible for every human being that acknowledges injury. And so I say that the first step is for us to acknowledge the injury. One of the reasons why it has always been thought that Black people can endure more pain than anyone else is because we square our shoulders. We hold our head up and we say, I'm okay. I can get through this. I'm fine. When really we are not. When inside we are falling apart. And so we need to move to a place where we can acknowledge the injury and then we can move to a place of wholeness. Thank you. Oh, I do have some information, thank you, being shared on the line. Help is available, and the information being shared is for the National Suicide Prevention Lifeline and the National Alliance on Mental Illness.
Thanks so much, Pastor Francis. And then as well, thanks so much, Elder Julia and Pastor Tori Fingo. I appreciate you guys giving me this chance to share. I'm gonna turn this part right back over to you guys, and I'll be watching as we go along. Thank you for inviting me and let me play a part.
Thank you, Bishop.
Thank you, Bishop. Thank you so much.
It's incredible. The information that's been shared so far. As a matter of fact, Bishop Gordon put the title of the book that he shared in the chat, and so we can make sure that we pastors who are on the line, if we're interested in that. Pastor Frances Teabout, she said her millennial was helping her. I thought you were a millennial yourself. I'm being very serious too. I put it in the chat. I said, man, that hashtag black don't crack, right?
Thank you, sir.
Oh man, these conversations are so important. One of the things, I started a blog called Black Saved and Smart. Black Saved and Smart. To begin to look at some of these issues and even texts in our sacred texts through an intersectional lens. And one of the things that I said is that when instances of police brutality and all of those things happen, white people have the opportunity to view those things individually, to view them as one instance, one bad apple, right? They always say it's just one person. But we, Black folks, we feel them historically, right? And so when George Floyd happened for us, it was Emmett Till happening all over again. It was Amadou Diallo happening all over again. It was Sandra Bland happening all over again. And the truth of the matter is that takes a toll on your mental well-being. And so there's a new thing amongst millennials that we all say, you can have Jesus and a therapist. Having a therapist doesn't mean that your faith is weak or that you don't love God. You can have both and still be a fully saved, fully functioning, heaven-bound, Holy Ghost-filled Christian. Amen. And I shared earlier about, being diagnosed with diabetes. I was, 22, 23, something like that. And I was drinking about 5-6 Cokes a day, and eating terribly. Not eating bad, because we all eat bad. No, I would call my wife on the way home and say, what you got for dinner? And she'd tell me. I say, oh, I can't wait. I would stop at McDonald's on the way home, get food from McDonald's, like a Big Mac, a large fry, and a large Coke. Eat the food in the car on my way to the house. Put the trash, that was terrible. Put the trash in the outside trash can, go in the house and eat 2 plates of food with about 3 cans of Coke. It was terrible. It was terrible. But a lot of times what is called in the medical community hereditary is actually probably less about passing down diseases than it is passing down lifestyles and choices and recipes. And so, food for me has always been like a celebratory thing. Like, it increases my mood. It made me feel good. So I just ate as much as I could. And, it could have had dire effects on me, we had been married for 2 months? She would have been a widow. And so I'm so glad that I was able to kind of make the changes and do what I had to do. But we want to talk to Pastor Hilton Rawls and Denise Peoples about diabetes awareness and the New Jersey Sharing Network, Oregon donors, that network. Pastor Bishop Gordon, I'll say this right before I clear the way for Pastor Rawls and Sister Peoples. One of the things that you said, it impacted me in a major way. You said that as a result of your church's health initiatives, people in your congregation who needed organs, they were able to have them donated by people in your congregation. I'm in the middle of earning my Master's of Divinity. And so one of the things I'm studying is the history of the church. And to me, that just is the definition of church and of community and of family. And what we're supposed to be is a body of believers, a community of believers. When I need something, I shouldn't have to go out into the world to get it. I should be able to get it right in my church, within my community, within my family, with people that I know who love me and who I love them. That really, I just had to kind of lift that up. That really blessed me. And I think that even that's what this is today, coming together as the body of Christ to share information and share resources. And so, Pastor Rawls, we're going to turn it over to you. And Sister Peoples, there she is. Yes. Thank y'all so much.
Bless you, sir. Thank you so much. I am honored to be a part of this cavalcade of what was that you said? Black and smart. I got to get the hashtag. I'm going to use that. There's been so much said today on the line that I am in agreement with, that I have been informed with. This is so unfair because there's so much I would love to respond to. But let me begin here. I just want to, I think I'll probably be best here in sharing my testimony. I rise giving honor to God, saints and friends.
Watch yourself, sir. Watch yourself.
I'm just really, really glad to be a part. Thank you, Elder Feature, Bishop Carlton, who is family, to Bishop Gordon, Dr. Mack, Dr. Torrey, all of you all. I've heard such brilliant things today, and I can't address them all. But let me just jump on where you left off, Dr. Torrey, when we're talking about food. I am 7 years out, a kidney transplant recipient. Like you, everything you were saying about diabetes, I can identify right away. I was chuckling while you were talking. We all come from a community where we express affection with food. I got jokers who won't say I'm sorry, but they ask if you want something to eat. For my early 20s, let me just jump back real quick. In my early 20s, my late 20s, I was experiencing incredible thirst. I was chasing it with grape soda and Pepsi, the greens with the meat, and losing great amounts of weight. I was 260, and I had lost like 70 pounds in a matter of months, and I didn't know what was going on. I was in denial until I got really, really sick. When I finally went to the doctor, I was encouraged by a friend to go to the doctor, and the doctor said, "Mr. Rawls, you have diabetes." It didn't register with me because I thought diabetes was an old people's disease. I thought it was the sugar. And I thought that, I was young, I was invincible, it couldn't affect me. And so I continued to eat. I would not educate myself on it. And so the years passed. And even as I saw my body and the function of my kidneys I still ignored it. Fast forward, 4 heart attacks, 3 strokes. 1 stroke, I was standing in a Walgreens talking to the young lady behind the counter, and I felt my mouth twisting. I knew what I wanted to say, but my mouth was twisting. I remember her leaping over the counter and saying, "Mr. Rawls, you're having a stroke." And I was taken to the local medical center. No family history of diabetes. But I find myself here in this position where I continue to ignore the signs. I remember when I was first told that I had diabetes, they put me on a medicine called metformin. And I'm still continuing to eat, never change my habits. it all came down to at 45. Now here it is, almost 20 years later. At 45, the doctors say to me, Mr. Rawls, you're going to die. They said, Mr. Rawls, you're not going to make it to 50 years old. They said, if you don't get a necessary kidney transplant, they said you're going to die, and you should begin to get your life in order, inform your family members of where you're going. It rocked me. It rocked me because it finally crystallized that I had abused myself. No one did this to me. I did it to myself. Ignoring the signs, eating any kind of way, and not taking responsibility for my health. Now, here's why I say I'm a miracle. One, I've had friends who died from one heart attack. I've had 3. I've had friends who passed away from strokes. I believe it was God's intention for me to live, but for me to be responsible and to live better. I had a baby at the time. My baby boy was 3. My oldest son was 19. I had a wife, and I wanted to live. The situation I found myself in, though, was after all of that, this was prior to Obamacare. I did not have health insurance. I had lost my job. I had no health insurance. The COBRA payments were too expensive. The doctor said to me that without insurance, it would cost $650,000 for the operation and for the medications. I didn't have $65. I've got a blessed community of friends. I had some celebrity friends of mine who flew in and did a benefit for me. And that raised some money, but it still wasn't enough. But it's funny because through this, I was able to connect with several agencies. One of them in particular was the New Jersey Sharing Network. My friend Denise Peoples is on the line today, and she is a representative of the company. And they exposed me to a whole lot that I didn't know about organ donorship. They held my hand. They were a part of the benefit that night. And since then, I've become a partner with them, and also wrote an article in Root Magazine a few months ago about pastors and our responsibility in sharing with people our need for, or our position as leaders in helping people reshape the way we eat. Here's the reality, is that if we all have an assignment, that assignment cannot be completed if your temple has not been maintained. And a lot of us can expire before our time because we did not take time to take care of our temple. I'm grateful today that I'm here. I had 20 people say, we'll donate a kidney. None of them showed up to be tested. I have 5 brothers, and it was one of my younger brothers who at the 9th hour, who has a family and children of his own, he volunteered his kidney. Thank God for him. I was on dialysis for 30 days. But when he was tested, and he was a perfect match. And so I'm here today. There are a number of variables, and I'm kind of jumping all over the place. But I've learned so many valid lessons here. One, instead of being reactive, we ought to be proactive in our communities. We've got to talk more about the way we eat. I heard Tori's mention about the traditions that we pass down, the things that we eat. I'll be honest, I still struggle with backing away from the table you know, with pork. My mother's house, you know, my mother fries everything. My mother fries spare ribs. Who does that? But they good. But I have to learn how to back away from the table and make much more healthier choices. And then sharing information. There are so many things that have been taboo in our community, from doing self-examinations, from going to the doctor, taking medications. Dr. Francis Teabout talked about counseling. I don't think anybody should be released or ordained in ministry if you haven't gotten a counseling degree. That's just me, or some kind of certificate. Frustration needs a voice, and in these times, people need someone to talk to. And even as it relates to my transplant, organ donorship. I'm alive today because of organ donorship. I had never considered it before, never marked it off on my license application, but it is something that more and more we need to talk about. In the past 7 years, I've had 8 friends, African-American males, whose kidneys have failed them. This is unusual. Young, strong, healthy men who now are in need of kidneys. Thank God for the New Jersey Sharing Network. I'm not sure if there are other networks like this that exist in other states, but I had no idea that New Jersey Sharing Network existed, or that they were an aid to people here in the state. But they are a gift, and I'm really appreciative to them. And anytime they need Pastor Rawls, they know they can count on me to show up for them and assist them. So that's my testimony. I'm grateful for the platform to be able to share, and anytime I can advocate for any organization or any cause that wants to help educate the people in our community, particularly people of color, I'm there. And so Dr. Feature, thank you so much for including me in the number today. I'm going to hang on the line, and I've got a bunch of notes from you all talking today. I'm trying to see how much more I can glean today. So I'm on till the end. Thank you. And I'm appreciative, praying for you and the God Vision family.
Thank you, Pastor. You hit something on the head that I didn't even share when I was sharing my testimony, and that is because I knew as a young Black man, I knew so many people in the 80s. When I got diagnosed, it didn't register with me as something that was super duper serious. It's just diabetes, something that happens, I suppose. So, you know, it is what it is. And I didn't. Just like you didn't change anything for a while. You know, you get that initial, like, oh, I'm going to change everything. And then 3 weeks later, I was back at Popeyes. You know what I mean? But that this is important. We have to normalize this idea that what we put into our bodies is important. And we have to normalize not expressing our emotions with food. You know what I mean? I mean, man, when you said, I got people that won't say I'm sorry, but will bake you a cake, man, that is incredible. Isn't that something? And so one of the things that helped Pastor Rawls was the fact that there's organ donors who was there. You know, if it wasn't for that, who knows where he'd be, where this great man of God would be. And so, Sister Peoples, I want you, if you would, share briefly about the New Jersey Sharing Network, because I think this is important. This is a conversation that we haven't had in our communities in a while.
Yes. Good afternoon. Thank you, Pastor Tori, and much love to Sister Elder Feature. Thank you all for having me. Pastor Rawls for hooking me up with Elder Feature. Thank you all, and much reverence to Bishop Carlton. To everyone here, thank you. I am full already from everything that was said. It has been amazing. I am Denise Peoples, a little girl from Paterson, New Jersey, now in Newark. And it's amazing to me. I grew up in the Church of God in Christ. And it is amazing to me how God orchestrates our lives, because he does stuff sometimes and you're like, how did I get here? But being here is the right place for me to be. And I am grateful for this time. Thank you all so much. And I want to share my screen. First, I want to tell you, we all talk about generational wealth, but you cannot have generational wealth without generational health. And both together leave legacy. And all of that together equals power. Let me see if I can get this. Here we go. All right. All right, you have the power to save lives. The New Jersey Sharing Network is the organ procurement organization for the state of New Jersey. Every state does have an organ procurement organization. We call it OPO. Some states have two, like North Carolina, because it's a really large state, but every state has one. Our mission is to save and enhance lives. These slides just show what our facility looks like. The bottom right is a place where employees at the Sharing Network get the opportunity every single day we are in that office to see why we do what we do. That's the names of all of our donors from 1998 until the present, and our donors in spirit. And those are people who either signed up on to be organ donors, or their families consented for them to be organ donors. And unfortunately, because of different circumstances, the condition of their bodies, prior medical conditions, whatever the case is, they were unable. We still honor them. And we're located in New Providence, New Jersey, and we have a website. It is njsharingnetwork.org. You can go to your state, go to your website, to the internet, and find out what is the name, excuse me, of your OPO in your state. So let's talk about how many people are waiting in the United States of America. There is 115,000 people. 28% of them are African Americans. Only 12% of African Americans are registered organ donors. Yes, we know myths and misconceptions. One being, I was born with it, and God knows I'm going to take it with me when I go. Please tell me why. When you can save a life. I don't know, something. Excuse me. So, at the Sharing Network, we came together and realized that disparity in how many people are waiting and how many people are actually registered needed to be addressed. Excuse me. We started the hashtag Donation Needs Diversity, one voice, one vision, and it lends to the fact that communities of color, not just African Americans, but as you can see, communities of color need this information. The rabbi that is on this screen, and I think you can pick him out, he donated twice. You can be a donor, a living donor, as you know, with kidneys, and also your liver. Liver comes in two parts. You can donate smaller lobe to someone, and the liver regenerates and it grows right back. So he donated his liver and his kidney, and we'll tell you if he could do it a third time, he would. But donation needs diversity. Just like voting has power, we need to understand and know that donation has power, transplant has power, as you can see by Pastor Rawls. So the organ donation is really rare. The gift is rare because it is a gift. Everybody who is registered, everyone who could be a donor, less than 0.1% go on to become organ donors. So because you were smart and proactive and thought that you were doing the great thing of registering to be an organ donor, and we applaud you, we thank you. But less than 1/10 of 1% actually go on to be organ donors. That is why it's 115,000 people waiting. This beautiful lady here, Miss Bray, gave the gift of life when her daughter passed away. She is now an advocate for the New Jersey Sharing Network and sings the song of being a donor loud and clear in Plainfield, New Jersey. She is amazing. I can't come to you and talk to you about something I don't know. I was brought up, you gotta have something to say. And I know what I'm talking about. This is me 14 years ago, as of October 2nd, 2020. In October 2nd, 2006, I received the gift of life with a double lung transplant. My donor, 18-year-old out of South Carolina, gave me a gift greater than any gift other than salvation. And soon after, I was able to go back out into the real world. I started volunteering for the network and started to speak all over the state, go to different states and speak. And finally, they were like, okay, we want to offer you a position. And I was working in government, and it wasn't even a choice. It wasn't even a thought, a second guess. I went to work for the New Jersey Sharing Network. Now I get to talk to families at the worst times of their lives in the hospitals. I get to educate all communities. But there's a major, major passion in my heart for our community, because I have been in the company of a Muslim family that will tell me that my religion does not believe in organ donation. There is no religion that states that they do not believe in organ donation. When it comes to registering to be an organ donor, donor designation is legal consent. It is just like your living will or your advance directive. If I want to leave my brother $5,000 and leave my sister $50, my brother will get $5,000. My sister will be unhappy, but she will get $50 because I have written it down. I made the vision plain. I wrote it down. So there's ways that you can be an organ donor. You can either go on to the registry and and register. I got voting on my mind, Lord. Driver's license or the online registry, the advance directive, your living will. You can go to our website, or you can go to registerme.org. And by doing that, that is not all that you need to do. You need to have a conversation with your families. I know we do not talk about money. We don't talk about politics. And God knows we are not trying to sit down and talk about our wishes when it comes to death. But these are things that we must talk about, because 100% of our patients are not walking around on the street, sitting at home. No, they're in a hospital on a ventilator or a respirator, unable to speak, have been pronounced brain dead, or it is cardiac death. Those wishes need to be addressed to your family. The Sharing Network also, we adhere to a national initiative called National Donor Sabbath. And the month of November is National Donor Sabbath month. If you check out our website at njsharingnetwork.org, we are going to have a panel of faith leaders, and it is called What Does Your Faith Say? We have an imam, we have a pastor, we have a rabbi, and many more. Pastor Rawls has been a part of all of our National Donor Sabbath initiatives. He is we have a manual that is really good for faith leaders. You can get that on our website, and it talks about things that you can talk to your congregation about organ and tissue donation. It helps answer questions. It's got scriptures, and it's even got some hymns in there. We make sure that we come complete. And I told them when they asked me to take over that initiative, I said, well, there's some things that we must have. And we have to go about that by finding different things that will appeal to faith-based organizations. So I want you to know there's no greater gift than the gift of life. Without the organ donor, there is no story, no hope, no transplant. But when there is an organ donor, life springs from death, sorrow turns to hope, and a terrible loss becomes a gift. Here is my contact information. If you have any questions, and no question is off limits, absolutely none, because I would rather you ask them now. Email me, ask your questions. No question is crazy or, oh, I shouldn't ask that. No, ask those questions. I'd rather you ask them now. I am blessed and highly favored to be with you today and to be able to share, not only just, let me stop sharing here. Where do I do that? Stop share. There we go. Not only am I blessed to be here today to share my story, but to give you information, just like we've been giving information about voting, mental health. These things are things that our community needs to address. And this is one of the things that I told them we had to have if we were going to go into a church. And believe it or not, the people in the mosque and the rabbis love these. These are fans. And they talk about organ and tissue donation. So if you need some, I don't know how many of you are back into your edifices, but if you need some, I'll send you some. And we do virtual presentations. So if your health ministry would like us to virtually come to you, if you can't get in touch with your OPO in your state, the information is the same. The numbers might be different, but willing and able. And as I always say, there's no greater gift than the gift of life. And my favorite saying for me is breathe easy. God bless you. Thank you.
Thank you, Sister Peoples. Well done. I do have a question that popped up in the chat. Somebody's asking about partner sharing. Could you shed some light on that and share some information about partner sharing? Because I know that's something that's available in a lot of states.
Now, when you say partner sharing, you mean if someone needs a transplant and they know someone, or?
Yes.
Oh, okay. Well, in New Jersey, strange you should say that, we have one of the biggest donation chains to ever happen. And it was 19 people. So in other words, if I needed kidney and someone else was going to get checked, but they were not a match for me, but say someone they know is a match for me. So the person would donate to me. The other person that could not donate couldn't donate to me, would donate to someone else. And it starts a chain. The 19 people are, like I said, are right here in New Jersey. So go get tested for living donation. You may be able to bless somebody you don't even know. The rabbi did not know the two people that he donated to. And that is, special. You can go to your transplant center in your state and go in and ask about being tested to be an organ donor, a living donor. And that is kidney and liver. And there's also tissue. And that, of course, is when you are deceased.